Hi, I'm Thomas. Welcome to the Parachute Advice Podcast. My life has taken a lot of twists and turns, and on this podcast, I will dive into those experiences. The goal is to help everyone listening learn from my experiences and hopefully avoid some of the mistakes I've made. Hi, welcome to today's episode of the Parachute Advice Podcast. I'm your host, Thomas. Today, I want to give everyone a quick follow-up on the cardiologist visit and the test results I had done that I mentioned in the earlier episode. First off, the echocardiogram. An echocardiogram checks how your heart's chambers and valves are pumping blood through your heart. It uses electrodes to check your heart rhythm and ultrasound technology to see how the blood moves through your heart. I'll have to say the test was certainly interesting. They have you lay on a table with no shirt on while they move an ultrasound probe around your chest with a gel that's there to aid conductivity and make sure the image is clear. From time to time, they will stop and take photos using the ultrasound machine. They also record the sound of your heart pumping. It's interesting because you can actually see the blood flowing on the screen and the valves moving. Overall, the results of this test came back as no issues found. All of the valves and chambers of my heart showed to be functioning within normal standards. This was good to hear and not overly surprising. I was much more interested and concerned about the next test. It was the big one. A Ct Angiogram with contrast dye. First off, this test had a lot more prep to it. You can't consume anything that may raise your heart rate for 24 hours prior to the test. This includes the standards like caffeine, nicotine, and other stimulants. Some other things they mentioned were things like chocolate, soda obviously, Excedrin, and Viagra. You can also not eat for 12 hours leading up to the exam besides clear liquids. You will also be asked to get a blood test ahead of time to check the function of your kidneys, since the contrast dye can be very difficult on your kidneys, especially if your kidneys aren't functioning at 100%. During the test, you'll need to keep your heart rate below 60 beats per minute. If at any point your heart raises above 60 beats per minute, they may pause the test, and if it continues to be an issue, they may give you medication to slow your heart rate. For me, with all the cardio and the weight loss, this wasn't an issue. I even at one point had to explain to the nurse about my weight loss in the cardio because she was so shocked to see my heart rate sitting between 49 and 55 for the entire test. The reason your heart rate needs to be so slow for the test is so they can get the clearest images of your heart between beats. A little more information on the procedure itself. A Ct Angiograph is a type of medical test that combines a CT scan with an injection of a special dye to produce pictures of the blood vessels and tissues in the part of the body being scanned. The dye is injected through an IV line that's started in your arm or hand. A computerized tomography scan, or CT scan, is a type of X-ray that uses a computer to make cross-sectional images of your body. The dye injected to perform the Ct angiograph is called a contrast material because it lights up the blood vessels and tissues that are being studied. By lighting up the vessels, it also allows them to see any blocked or otherwise unusual vessels or blood flow within the area being scanned. There's also a slight risk for cancer from repeated exposure to radiation, but the benefits of getting an accurate diagnostic test generally outweigh the risks. The amount of radiation used during CT angiograph is considered minimal, so the risk for radiation exposure is low. No radiation remains in your body after a CT scan. Other risks might include allergic reactions to the contrast dye. If you've had any history of allergic reactions to contrast dyes, make sure to tell your doctor. You could suffer minor tissue damage around the point of the IV from the contrast dye, though very rare. I'll say the biggest thing I noticed, and one that I was warned about, was when the dye is injected into your blood, everywhere in your body your blood flows feels warm to even hot. Places with extreme concentration of blood vessels can feel downright hot and almost burning. For example, your lips, the tips of your fingers, or your ears. During my test, I was also given nitroglycerin. This is common for a CT angiograph of the heart. It opens up the blood vessels prior to the injection of the contrast dye, allowing it to flow better and let the radiologist get a clearer picture of the images. This test is often done in a hospital or an outpatient facility that has a CT scanner. Here's how the test will go and what may happen during the test. You will be placed on the exam table and positioned by a radiologist technician. An IV line will be placed in your hand or arm. As the contrast dye is injected, like I mentioned earlier, you may feel a warm sensation. You will also have a brief metallic taste in your mouth. To me, that was a bit surprising. I'd been warned about it, but I wasn't expecting it. It was like my mouth had been filled with pennies. The radiology technician will leave the room just before the exam table moves to the scanner. The technician will be able to observe you through a window from an adjacent room and may talk to you over an intercom. Scanning is painless. You may hear clicking and buzzing sounds from the scanner as it rotates around you. You may be asked to hold your breath during the scan. I'll warn you, this came as a surprise, but that will likely be from a pre-programmed voice played through the machine. Depending on what body area is being scanned, the test may only last for 20 minutes or could take over an hour. In my case, it took about 20 minutes. Post-scan, the two biggest side effects were a headache from the nitroglycerin, which was amplified by the fact that I hadn't had caffeine in 24 hours. I drink far too much coffee and caffeine most days, so not surprising. This was easily remedied by going home and having some coffee and an Advil. Second is there will be a need to flush the dye through your kidneys. They're going to ask you to drink 6 to 8 glasses of water above and beyond what you would normally consume during the day. So there's going to be a lot of trips to the bathroom. When I got home, I grabbed a 32-ounce cup and just made sure to slam that with water in it every 2 hours 4 times. As for my results, they weren't terrible. As the doctor put it, there wasn't really anything too concerning. And as long as I continue on my current lifestyle, the healthy eating, the cardio, and keeping the weight off, there shouldn't be any long-term concerns. That said, there was a blockage found, and I did not get a perfect cardiac score. Not surprising. The official results were mild, non-obstructive coronary artery disease involving the proximal, left, anterior descending coronary artery, associated with less than 25% but greater than 1% luminal stenosis due to mixed calcification and soft plaque. In simple terms, there was a clear and noticeable blockage observed. As for my total coronary artery calcium score, that was 33. What does that mean? The score reflects the total area of calcium deposits and the density of the calcium in your arteries. A score of 0 means no calcium is seen in the heart. It suggests a low chance of developing a heart attack in the near future. When calcium is present, the higher the score, the higher your risk of heart disease. A score of 100 to 300 means moderate plaque deposits. It's associated with a relatively high risk of a heart attack or other heart disease over the next 3 to 5 years. A score greater than 300 is a sign of very high to severe disease and heart attack risk is likely. The final results of the visit, I have a checkup in 2 years just to make sure I'm still on track. And then he said he'll likely order another Ct Angiogram scan when I hit the age of 50 to compare to the baseline we've set. Last, and the proudest part of the visit for me, was when I asked about my heart rate. His nurse who checked me in the day of my follow-up, and the nurses who took care of me during the CT scan all had noted in my chart a low heart rate. Since so many people seem to be focused on that, it started to get me concerned. As a result, I decided to ask the cardiologist if there was anything I should be concerned about. First, he asked me a few questions. Have I been fainting or getting dizzy? I said no. Then he asked if my heart rate goes up when I do strenuous activity. I said, of course. Finally, he asked how much I've been working out, and I explained that lately I've been averaging 20 minutes 5 to 7 days a week of high-intensity cardio. This is when I got the shocking answer for why the heart rate was so low. My heart rate and resting heart rate is so low because I've successfully dieted and worked out to the point that I'm considered an athlete by his standards. I never thought I'd hear a doctor say that. He compared me to an athlete. All of the effort has paid off, I guess. His nurse went on to explain after he left the room that all of my numbers, including my blood pressure and cholesterol, were excellent, and they were actually where they would want somebody who had a high risk of heart disease and heart attack to be. And seeing as my test results had come back so good, there was no risk as long as I stayed on this track. So here's the real kicker. I should be happy as hell. I'm going to likely live longer than my dad did. Well, at least I won't go from a heart attack. It's still going to be something stupid, but let's ignore that for now. Yes, I do a lot of stupid shit from time to time. I've stopped taking headers off second-story balconies into frozen rivers. A story for another time. But you never know. So why am I pissed off? Well, I spent all of those years wasting my time thinking and planning for this inevitable death before the age of 50. Frankly, that was a complete waste of time. I literally spent years of my life worrying about something that I just found out is probably not going to happen, assuming I continue to avoid doing stupid shit. What a giant waste of time. I look back at all the things and experiences I probably missed out on because I was so focused on that fatalistic view. A view I held for over 30 years because my dad died when he was so young. That's a real kick in the nuts. But now I focus on the upside. I probably have 30 or 40 years ahead of me to make everything right and enjoy my new healthy lifestyle. Thank you for listening, and I look forward to you joining me for future episodes of the Parachute Advice Podcast. You can contact me at parachuteadvicepodcast@gmail.com. That's all one word, parachuteadvicepodcast@gmail.com. You can also follow me on Instagram at Parachute Advice. Thank you for listening, and please like and subscribe wherever you get your podcasts.